So good morning, everyone. Thank you for the introduction. And this project is a joint project between Alberta Health Services and the University of Alberta. And today I'm going to share some of the research on using the sensor for monitoring medical implants. And I will only focus on one application for today. But there's a lot of application on these devices. So medical implant is not a new technology. In 1958, people already building a pacemaker implant into the body. But it's until 1980s, people using the inductive method to transfer the data between the body and the device. And at that time, most using the low the frequency around 1 megahertz and the power consumption less than 10 milliamp. It's until 1999, the FCC decided that we need to have a specific frequency band for using for medical devices. So they select using the 402 to 405 megahertz frequency for this specific medical implant device. And at that time, by 2003, there's already MIPS devices existing, and most are using for the pacemakers. As you know, there are many applications on the implantable devices. So you can use for hearing aids, you can use to monitor the glucose inside the body. So as you can see, you can also use for the home-based monitoring. There's at the Glen Rose Rehabilitation Hospital, there's a lot of patients. They have stroke, they need monitoring. So one of the applications is you can implant into the pacemaker instead of the patient need to report to the physician about his health. He can sleeping really well, and the device can automatically dial if there's an emergency. Also, you can use it in the operating room and monitoring the information, as well as later on you can use it in a doctor's office. So today I will only focus on one of the applications. In my research is on scoliosis. And what is scoliosis is a three-dimensional curvature of the spine with vertebral rotation. As you can see here, this is a patient have scoliosis, and this one is a normal spine. And this patient have scoliosis. 80% of the cases have unknown cause, and we call idiopathic scoliosis. And it affects approximately 2 to 3% of adolescents, and approximately 1% require treatment. And back to the early 20s, as you can see here, at that time when you're treating the scoliosis, basically it's the nursing teaching the patient how to straighten their back. In mid-20s, and people thinking about hanging the weight on body and then try to straighten their body. And these days, surgery is the only method to treat scoliosis when they have a severe scoliosis. So back to 1962, Harrington Rock is the first one designed the device to treating the scoliosis. So, but at that time, it's only a two-dimensional, basically only straight. But in 1988, it became a three-dimensional correction because scoliosis is a three-dimensional problem, not just a 2D problem. So during the scoliosis surgery, the surgeon required using some of the screws or hooks to putting to the vertebra, and also putting the rod to correct the scoliosis. And the objective of this project is to measure the forces and moment transferred to the spine during and after the scoliosis surgery. So during the scoliosis surgery, we can provide the feedback to the surgeon about the safety issue. And after the surgery, we want to monitor the residual forces correlate to the curvature changes. So the goal is to provide real-time feedback of load to surgeon, understand the residual forces in the spinal instrument, and also using this information to develop a computer model for procedural planning. So as you mentioned, we are working on a sensor that will implant into the body, monitor the load, and the frequency band that we are using is at the 402 to 450, 405 megahertz. And this reserved for medical devices, as you can see in here, is way below the Wi-Fi, Bluetooth, or Zigbee. So this is the design of our system. So we have designed a wireless implantable sensor platform. The reason is we have a lot of other medical application. So when we build it, we try to build as a module so that we have a platform on wireless platform, and we can attach to different sensor for different applications. So right now we are one of the design, we're still using the inductive to power the device. But we also have a PhD student working on the kinetic energy, so based on the body movement to generate the energy. And that's not a new idea as well, because there's a lot of company out there working on the same idea, using the kinetic energy or the heartbeat to generate the energy. So the market is huge, like people talking about $1 billion putting into that market. So we are also working on that. And also on the sensor side, there's a lot of application, lot of different devices that can attach to this wireless platform as well.